If anatomy feels like a giant list of structures in your head, this video will help you. I'm going to show you a simple framework that turns any anatomy topic into 7 different categories. And once you start using it, anatomy becomes much easier to remember. I call it the 7R anatomy map. It's a simple framework that turns scattered anatomy facts into a clear structure that your brain can understand and recall. When I first started studying anatomy, I struggled. In fact, in the early stages of my anatomy education, I performed terribly. The problem was not that I was not studying, I was studying a lot, but the information felt overwhelming. Every lecture was like a long list of facts, muscles, nerves, blood vessels, and a whole lot of other structures I had to try to remember. So I kept asking myself, is there a systematic way to approach anatomy? And then I started paying attention to how anatomy is actually taught. And I noticed something very interesting. Almost every anatomical topic follows a pattern. We start with a region, we describe its boundaries, we talk about the content, and we learn the relations. And after that, we discuss the blood supply, the innervation, and the clinical relevance. So you see, anatomy was already organized, except that students were not taught how to organize it in their minds. And that is when I developed this framework, the 7R anatomy map. And when I started studying this way, everything changed. It stopped feeling like an overwhelming, scattered facts that I have to struggle to remember and understand. It started feeling structured, logical, and much simpler to handle. I also see the same problem in many students I teach. When I ask a question, many students try to remember random facts about the topic. Their answers come out scattered, not because they don't know the material, but because the information is not organized in their minds. For example, when I ask, what layers must a surgeon cut through to reach the appendix in the abdominal cavity? Students try to recollect random facts about the abdominal wall, skin, muscle, fascia, all right? They know the pieces, but the order is unclear. But when information is organized, it becomes much easier to remember. You start from the surface and you move inward. So skin, fat, fascia, muscles or aponeurosis, peritoneum. And finally, you are in the abdominal cavity. Now, the layers form a logical pathway instead of random facts. Think of the brain as a giant file system that has different cabinets. The information you are reading or the anatomy you are trying to learn will be the files. Now, if you are just reading topics, the information is just scattered in your file system. But when you organize and file them in different cabinets, it becomes much easier when it is time to recollect and apply it. And that is the principle behind the 7R anatomy map. The 7R anatomy map organizes anatomy into 7 simple categories. Each category starts with the letter R. This makes it easy to remember. We'll talk about the region, the range, the residence, the relations, the rundowns, the routes, and the relevance. So let's go through them one at a time and see how you can apply it to your anatomy study. Region. What anatomical area are we studying? So cubital fossa, femoral triangle, axilla, these are the regions. So the region of interest for a particular topic. It could also be the orbit, it could be the temporal region, it could be the pectoral region. and most anatomy education organizes around regions. Then the range. What are the boundaries of the region we are studying or we are discussing? What are the limits? What is the lateral boundary, the medial boundary, the posterior limit, the anterior limit? All right, that is the range. And most interestingly, the residence. These are the structures located within the region that we are studying. So it could be muscles, nerves, blood vessels, and structures or organs located within the region that we are studying. So the contents, the residents. And then relations. Anatomy deals with relations a lot because it is important in clinical practice, and it is important especially in surgery. When a surgeon is approaching a particular area, he has to be aware how the structures in the region are related. What is on the left? What is on the right? What is posterior? What is anterior? So relations. How are the residents related to each other? Okay. And then also, what are the structures that bound or are related to the region that we are studying? And then we come to the rundowns, which is the subdivisions of the region we are studying, or the compartments. This particular category may not apply to every topic. For example, if we are looking at the mediastinum, then we have subdivisions. We have the superior mediastinum, then the inferior mediastinum. And the inferior mediastinum is also further divided into the anterior mediastinum, the middle mediastinum, and the posterior mediastinum. So we look at the compartments, the divisions, the rundowns. Then we talk about routes. Routes will be the pathways that are leading to the region or leaving the region. So anything that is a pathway, so nerves, veins, arteries, these are the routes related to the region. So when you are studying a region, you must pay attention to what are the nerves, what are the blood vessels, what are the lymphatic ducts leading into this region or leaving this region. And finally, and probably very important, is the clinical relevance. So the relevance, the last R. Everything we are studying in anatomy is for a reason. It is to guide clinical practice, examination, surgery, diagnosis. So what is the relevance for which we are learning these structures or this region? And that is the 7R. So we have region, we have range, we have residence, we have relations, we have rundowns, the routes, and the relevance. The 7R anatomy map. Let's briefly apply the concept of the 7R anatomy map to a region like the cubital fossa. So the region we are interested in now is the cubital fossa, which is located at the anterior part of the elbow joint, the cubital fossa. So we'll now talk about the range. All right, the cubital fossa is like it's triangular in nature. So there's a base, there's the medial border and the lateral border, right? So right here, the base is an imaginary line between the medial and lateral epicondyles. And then we have the medial border formed by the pronator teres muscle, and then the lateral border formed by the brachioradialis. So the two of them meet at the apex. We also have a roof and a floor. So for example, for the roof, we have skin, we have fascia, all right? And then we have the deep fascia of the arm, which is reinforced by the bicipital aponeurosis, which we'll talk about. So that is the range. Then let's talk about the residents. So the structures that live within the cubital fossa. We have the radial nerve, we have the brachial artery, we have the bicipital aponeurosis, and then we have the median nerve. So these are the residents within the cubital fossa, all right? And then we can talk about the relationships. So how the radial nerve passes laterally, all right? It passes laterally at the deep aspects of the cubital fossa. And then the bicipital aponeurosis passes centrally to insert on the radial tuberosity. And we have the brachial artery medial. and the brachial artery will terminate in the cubital fossa and divide into the radial and ulnar arteries. So now you see the relations. And now we can talk about the routes. The route will be the brachial artery and the nerves, which we have already described. All right. We do not have rundowns, so we don't have the cubital fossa subdivided into compartments, so it may not apply here. But important will be the clinical relevance. This is a region that is important for venipuncture and IV cannulation. So a lot of the times you are going to need a vein that is located in the superficial aspect or the roof called the median cubital vein, and it is mostly used to draw blood or to insert an IV cannula. Of course, the brachial artery is also located at the medial aspect, so you can use it to check the pulse of the patient. So this is why the cubital fossa is relevant. So you see now the region is organized, and you don't just have to remember or try to memorize the random structures and facts. Everything is organized using the 7R anatomy map. And I want you to apply this to every topic you study, especially in gross anatomy. You can use it to organize the information. And I'm going to design a worksheet that will further explain the 7R anatomy map and how you can apply it. You can download it freely and use it for every topic that you study to organize the information. The next thing you can even use it to do is to develop your own flashcards. So for example, you can use an AI, and after you have organized your 7R anatomy map, you present it to the AI and ask the AI to create flashcards for you or to generate questions from the topic, and then you test yourself on the questions. This is a very important way to learn anatomy, and it's an easy way and a very practical way to apply the 7R anatomy map. So to help you start using this immediately, I have created a free 7R anatomy map worksheet. The link will be in the description of the video. You can download it, you can even print it out or keep it on your phone, and for every topic you can organize the information that way. And like I said, you now don't have to try to remember everything at once. You organize the information first, and then your brain can retrieve and apply when it is needed. And if you want more videos that make anatomy clear, visual, and easy to remember, subscribe to the channel. Here on Clarity Anatomy, the goal is simple: turning complex anatomy into clear understanding.